Hey everyone, welcome back to my YouTube channel. Whether you are a patient curious about lipoma removal, a medical student preparing for exam, or a doctor looking for surgical insights, this video has got you covered. Today, we are taking a deep dive into lipoma excision surgery, covering everything from basic understanding to step-by-step surgical techniques including incision types, suture methods, and post-op care. Lipomas are one of the most common soft tissue tumors, and while they are usually harmless, sometimes they need to be removed. In this video, I'll walk you through what. So in this video, I'll walk you through with what is a lipoma and when it should be removed, a friendly breakdown of the surgery for everyone, advanced surgical details for medical students and doctors, post-surgery care and common myths. So, whether you are a patient, a student, or a surgeon, stay tuned till the end. So let's get started. First question, what is a lipoma? A lipoma is a benign, slow growing tumor made up of fat cells. It is encapsulated, which means it is surrounded by thin fibrous capsule. It is soft, movable, and painless unless it presses on a nerve. Found under the skin, mostly on the trunk, neck, shoulders, and limbs. Now let's talk about histopathology. Lipomas consists of mature adipocytes in lobules with fibrous capsule. They are benign mesenchymal neoplasms unlike liposarcomas which show atopia and invasion. They can appear everywhere, but they are most common in the upper body. The good news? They don't spread and aren't cancerous. Second question, when it should be removed? If pain or nerve compression present, rapid increase in size, which is suspected in malignancy, restriction of movement, especially near joints, cosmetic concerns, irregular, firm, or deep seated lipoma, which may indicate a different pathology. Most lipomas don't need removal, but if it's growing, painful, or suspicious, surgical excision is the best option. Surgical procedure. First, preoperative preparation, most common being anesthesia. For small lipomas, local anesthesia, which is 1% or 2% lignocaine with adrenaline, is used. For deep or large lipomas, regional or general anesthesia is used. Incision planning. Choose a skin crease or Langer's line for a better scar outcome. Incision options, elliptical, linear, or punchline incision for small lipomas. Second point, incision and dissection. Mark the incision site over the most prominent part of the lipoma. Step 2. Mark an incision with number 15 or 10 scalpel blade. Step 3. Use medicine bound scissors or blunt dissection scissors to expose the capsule. Step 4. Bluntly separate the lipoma using a peanut sponge or finger dissection. Step 5. Ligate feeding vessels if present using electrocautery or 30 Vicryl. Now tip for our beloved surgeons who are watching this video. Use hydrodissection, which means injecting saline around the lipoma for easier separation. Avoid excessive traction to prevent nerve damage. Third point, lipoma extraction and wound closure, which is in turn step 6 of this video. Completely remove the lipoma with its capsule to prevent recurrence. Step 7. Irrigate the wound with Norman saline. Step 8. Close the wound in layers. For deep fascia, use 30 Vicryl if it is opened. For subcutaneous tissue, use 40 Vicryl. For skin, use 40 Proline with interrupted sutures or subcuticular absorbable suture for better cosmetics. Clinical tip. If there is a dead space, use a Penrose or closed suction drain to prevent seroma formation. Postoperative care and complications. For pain control, use NSAIDs like ibuprofen and paracetamol. Wound care includes keep the wound dry for 48 hours and dressing should be changed on day 2nd. Suture removal. For face and neck, sutures are removed on the 5th or 7th day. For trunk and limbs, sutures are removed on 10th or 14th day. And we need to watch for some complications like hematoma or seroma formation, infections, which includes redness, pus, or swelling, recurrence if the capsule wasn't fully removed. Now, another tip for surgeons: post op compression dressings helps reduce swelling and hematoma formation. Now, let's talk about some myths and frequently asked questions. First myth: lipomas turn into cancer. The truth is, they are benign and do not transform into liposarcoma. Another myth: you can remove lipomas with massage or creams. The truth is, surgery is the only definitive treatment. Another myth: lipomas always come back. The truth is, complete excision with capsule removal prevents the recurrence. And that's a complete surgical guide to lipoma excision. If you are a patient, medical student, or surgeon, I hope this video helped you understand everything about lipoma removal. If you enjoyed this, don't forget to like, share, and subscribe for more detailed surgical videos. Let me know in the comment section if you have any questions, and I'll see you in the next video. Thank you so much.